But there are a few things that you can do like right away to try and be more cognizant of this, having this like a trauma-informed approach. So we always want to make them feel like they're in the driver's seat. Okay. We want to give patients a sense of control, especially folks who have elevated rates of sexual violence, like all people, not just queer and trans people, although it is elevated there. So we want to try and have these practices in place so that they feel more safe and they feel like they have a way to opt out, because a lot of people who've experienced violence, especially sexual violence, we know we have like the 4 Fs, right? So people think of fight and flight. Those are the two with the sympathetic nervous system. So fight being really reactive, or flight running away. Some people might be familiar with the one freeze, where you just like can't do anything, you're just frozen. And that does happen a lot too. And then there's also fawn, which is where you're like trying to appease and give a lot of positive feedback and energy to the person harming you in a hope that it will keep you safe so that you can get out of the situation unharmed. So fight, flight, freeze, and fawn are the 4 Fs. So sometimes folks, they're not able, because especially those last two, the freeze and fawn, it can be really difficult for them to actively, enthusiastically participate and give consent, especially when we're talking about things that can sometimes be physically invasive, like internal pelvic exams, but really any situation where your hands are going on a patient, or you're asking like sometimes invasive questions about their bodies, what they do with their bodies, etc. Sorry, I think there was a car going by. I wrote on the slide to try to greet them before they undress. Now, depending on who you are taking this, if you're a physician, I really encourage you. I know it's not always practical, but I know the medical assistant can take the person back and then tell them that the doctor will be in with you shortly and recommend that they take their clothes off. It's really, really better if we can try and have the doctor greet them before they get undressed. So they're not just, especially like for pap smears, I'm just laying on the table, legs open, etc. Try to greet them before they undress. And then for physical therapists or other rehab providers, I know the model's kind of shifting in some places now. If you have an assistant, like a physical therapy assistant or an occupational therapy assistant, sometimes they like greet the patient, they bring them back to the treatment room, especially for pelvic health. And then they have the sheets and they tell them to get on the table and have the sheets cover them, they're undressed. I really encourage you to try to greet them beforehand so that they feel like they know you, because for all intents and purposes, especially for like a pap smear, you might just be a stranger to them. And we don't want to trigger any of their experiences, especially if they have PTSD. Additionally, thorough explanation of the procedures prior to performing them. So I always take my little pelvic model and I show them like, here's your anatomy, here's what we're going to do externally. These are the muscles. This is why I'm doing it, what I'm testing for. I'm going to check these reflexes. I'm going to see if anything is tender to touch. I'm going to see your strength. And then like you have a choice. We can do this all external today if that's what you prefer, and we don't have to go internal, and here's the information that we'll find. Or if we go internal today, this is what information we're going to be more privy to.